So good day everyone. So for this video lesson, we will be talking about serous fluids. So let's start. What is serous fluid? Okay. So your serous fluid is the fluid that can be found in between or inside your cavities. Okay. So your cavities is lined by two membranes. Okay. So you have a parietal. Okay. So the parietal membrane is the one or yung nasa cavity. Okay? The visceral, second one, visceral is yung lining ng organ. Okay? So, for example here, this is the visceral, lining ng organ. Parietal is the lining of the cavity. In between that, you have your cavity itself. Inside that cavity, you have the your serous fluid. Okay, so we have three cavities. You have your peritoneal, okay, which contains your peritoneal fluid, pericardial, and then your pleural in between the lungs. Okay. So what is the function of the serous fluid? Okay, so its function is to provide lubrication within your two membranes. He'll provide lubrication for your two membranes. Okay, so that is to prevent friction between the two. Okay, so in cases of movement and contractions, for example, in your lungs, di ba nag-i-inflate si lungs? Okay, pag naghumihinga, yan. Okay, so that is to prevent the friction between the two membranes. Okay, so yun ang function ni serous fluid. So normally, serous fluid is found in small amounts only because the production and reabsorption takes place at a constant rate. Okay? Okay. So furthermore, your serous fluid is an ultrafiltrate of plasma. Okay, so it is an ultrafiltrate of plasma. So no additional material is contributed by the mesothelial cells. So what is the mesothelial cells na tinutukoy? Okay, so di ba you have the membrane? Okay, so if this is the membrane, the first layer doon is a single layer of mesothelial cells. Okay? Okay, so a single layer of mesothelial cells, yun yung first layer ng inyong mga membranes. Okay, so wala pong sinisecrete si mesothelial cells that contributes to the component of the serous fluids. Okay, so everything in the serous fluid comes from the plasma. Okay, so as I've mentioned, it provides lubrication to prevent friction. Okay. So the formation of the serous fluid depends on two factors, the hydrostatic pressure and the colloidal or the oncotic pressure from the capillaries. Okay, so oncotic pressure and the hydrostatic pressure. Okay, and also the capillary permeability. Okay, so yun po yung nagdidikta kung gaano karami ang pumapasok na fluid, gaano karami ang lumalabas between your space. Okay? Yeah. So if there is a disruption of mechanism of this mechanism, okay, so there would be an increase in fluid. Okay, so there is an increase in fluid, ang term natin doon is effusion. Okay? So what are the possible causes or the most common causes na magkakaroon ng effusion? Okay? So we can associate effusion if there is an increase in hydrostatic pressure. Hydrostatic. Also, if there is naman decrease in oncotic pressure. Okay? And if there is an increase capillary permeability. Okay, so doon po nagkakaroon ng effusions. Okay, so what disease can we associate if there is an increase in hydrostatic pressure? We can associate with it with congestive heart failure. Decrease oncotic pressure, we can see it in cases ng hypoproteinemia. Okay, ma-associate natin si hypoproteinemia sa nephrotic syndrome. Okay. Increased permeability, capillary permeability if there is inflammation and infections, and lymphatic obstructions. Okay, so those are the cases wherein you can have an effusion. Again, an effusion is an increase in serous fluid. So how do we collect your specimen, serous fluid? Okay, so this is performed by needle aspiration to the respective cavities. So we have 3 cavities, the pleural, pericardial, peritoneal. So iba-iba po sila ng tawag. Kung kukuha ka kay pleural, that is thoracentesis, pericardial is pericardiocentesis, paracentesis naman kay peritoneal. Okay? So where would we put our samples? Okay, so if you're gonna be doing cell counts, okay, so if cell counts, lagay mo sa EDTA. Okay. So if for microbiological studies, you can put it in SPS or sterilized heparin. Kapag naman chemistry, either red top or heparin. Okay? And then take note if for pH, if you're testing for pH, it should be traveled or placed anaerobically on ice. Okay? So for chemical testing, so alongside chemical testing with your serous fluid, you should also be doing chemical test with using the serum sample or blood sample ni patient. Kasi nga, di ba, your serous fluid is an ultrafiltrate of plasma. Okay? So you can use or gagamitin natin yung blood sample levels to correlate our chemistry results. Okay? So alongside of collecting serous fluid, you should be also collecting a blood specimen. So, we have 2 types of serous fluid. So, we can classify serous fluid as to either transudate or exudate. Okay? So, why do we need to classify transudate and exudate? So that you can know what is your next step in the diagnostic procedures or your laboratory tests. Okay? So, let's define it first. Pag sinabi mong transudate, so it means effusion is from or because of a systemic disorder that disrupts the balance in the regulation of fluid filtration and fluid reabsorption. Okay, so there's problem with the regulation. When you say exudates, okay, so exudates is produced by conditions that directly involve the membranes of the particular cavity. Okay, so there is problem or affected membranes. Okay, so where can we associate this? Transudates, may kakita natin sa congestive heart failure. Okay, and then also we can associate it with hypoproteinemia. Okay, so associated si hypoproteinemia sa nephrotic syndrome, di ba? Okay. Exudate we can see in cases of infection and malignancy or cancer. Okay? Okay. Yeah. So you know now the difference ng dalawa. Okay. So how will it tell you what is your next step? Okay? So that is because usually or hindi na po natin tinetest furthermore si transudate fluid. Okay? So if we have identified that it is a transudate, so hindi na po natin siya further tinetest. So why is that? Because there is nothing wrong with between the fluid or there is nothing wrong po aside from the regulation. Okay? So for example, congestive heart failure. So the problem, is within the heart. So yung heart yung may problema. Okay? So anong next nyo pong diagnostic procedure doon? Would be anything to do with the heart. Okay? So hindi na po or wala na tayong kinalaman kay serous fluid kasi that only a complication or a consequence of the initial or the primary condition. Okay, same with nephrotic syndrome. Okay, so if you have, we have identified that it is a transudate. Okay, so, and it is a transudate. Yan. So, ang further na gagawin mo is to test if you have kidney disease ba due to hyperproteinemia. Okay, so wala na pong kinalaman si serous fluid doon. Unlike with exudates, okay, so exudates happen when you have infection and malignancy within the area. Okay, kaya ang affected is with the membrane itself. Okay, so for us to know what type of infection it is or what type of malignancy it is that you have in that area, so we will further test yung ating exudate. Okay? Okay, sana nag-gets po yun. Okay. So, how do we differentiate transudate versus exudate? So, including appearance, so we can use appearance. Okay, so differentiate it using appearance, total protein, lactic dehydrogenase, cell count, and clotting. Okay. So, we can use this to differentiate transudate versus exudate. However, ang best differentiator po natin is this one, fluid to blood ratio for of protein and lactic dehydrogenase. Okay, so ito yung best differentiator natin between transudate and exudate. Okay. So, let's look at the table. Okay. So, laboratory differentiation of transudate and exudate. So, appearance, transudate is clear, pale yellow. Exudate is cloudy and variable yung color. Okay? So, cloudy, saan nanggaling yung cloudy? Di ba nga associated na rin si exudate sa infection? Okay? So, makukuha natin yung cloudy either microorganism or syempre presence ng WBCs. Okay? So, since infection. Okay? Color variable. Okay, variable yung color because it could also have RBCs when there is bleeding due to tumors. Okay? So, magba-vary yung color mo. Okay? WBC count. For transudate, it is less than 1,000 per UL. Okay, less than 500 per UL sa peritoneal. Kapag greater than 1,000, associated with high exudate. Spontaneous clotting, possible for exudate. Fluid total protein, and so on. And then, yung best differentiator nga natin is the fluid blood ratio ng protein and lactic dehydrogenase. Okay? So, fluid serum protein ratio. Okay, so, transudate is less than 0.5. This one is greater than 0.5. And also, where is it? Ito, fluid serum LD ratio. Okay, so this one is less than 0.6, greater than 0.6. Okay, so ito yung best differentiator natin. Okay. So, general laboratory procedures. Okay, so evaluate it first with regards to appearance and to differentiate it between transudate and exudate. Okay. So, if you have identified that it is exudate, so we can test microbiologically, cytology, and tests for general symptoms. Kapag naman transudates yon, we have identified that it is a transudate, so it is seldom tested further. Okay. So, cell counts are not routinely performed. However, differential count is routinely performed. Okay. Okay. So, moving on with pleural fluid. Okay, so let's move on na with the first type of serous fluid, the pleural fluid. Okay? So your pleural fluid, of course, it is obtained from the pleural cavity in between the visceral and the parietal membranes. Okay? And then, first off, we have to differentiate if it is a transudate or an exudate. Okay, so what we can use are the following, yung pleural fluid cholesterol, fluid serum cholesterol ratio, and bilirubin ratio. Okay? So, exudate always has greater than values, greater than 60, greater than 0.3, 0.06. Palaging sila yung mataas. Okay? Less than that is transudate. So, once we've known na exudate nga yung nakuha natin, okay, so we can test it further na. Kasi nga, if it is transudate, seldom na tinetest pa siya. Okay? So, yan. So, we have identified na it is exudate. So, what are the disease associations of that? So, clear pale yellow, that is the normal itsura ng pleural fluid. If you have turbid white associated with microbial infections, bloody, okay, if there is hemothorax or hemorrhagic effusions, pulmonary embolism, tuberculosis, or malignancy. Also, if traumatic aspiration, okay, so traumatic aspiration, you also have bloody. Milky, we can see it kapag there is chylous material. Okay, so we can see that kapag increase ang triglyceride and increase ang cholesterol. Increase triglyceride, increase cholesterol. Okay, so milky ang itsura. Brown, if there is rupture of amoebic liver abscess. Black kapag may aspergillus. Viscous, we can see it sa malignant mesothelioma. Okay. So, hematology tests for pleural fluid. Okay. So, cell count, again, cell count is seldom done, pero differential count is the most diagnostically significant test that we can perform on serous fluid. Okay? So, primary cells we can find sa pleural fluid, we have macrophages, neutrophils, lymphocytes, eosinophils, mesothelial cells, plasma cells, and malignant cells. Okay? So, ito yung normal differential po natin. Macrophages is 64 to 80%. Lymphocytes is 18 to 30%. And your neutrophil is 1 to 2%. Okay? So, what are the cases na hindi po nasusunod ito? Neutrophils, it increases. Okay, neutrophils first, it increases. Syempre, alam nyo na, kapag sinabing neutrophil, palagi, bacterial. Okay? Increase yung neutrophil kapag merong bacterial infection. Bacterial infection, okay, pancreatitis, and pulmonary infarction. Okay, so increase in neutrophil. Okay, yeah. Si lymphocytes naman, your lymphocytes increases in cases ng, okay, so ito increase in case ng TB, viral infection, malignancy, and autoimmune diseases. Okay, so increase si lymphocyte. So, moving on sa mesothelial cells. Okay, so as I've said kanina, si mesothelial cell is a single layer of cells within the membrane. Okay, so we can found it commonly sa serous fluid because it lines the membranes nga. Okay, so it is pleomorphic, dark blue cytoplasm. It has a fried egg appearance. Okay, yan. So these are your mesothelial cells. Yan. So parang sunny side up na itlog. Okay. So, lack of mesothelial cells is significant in tuberculosis due to exudate covering the pleural membranes. Okay, so if you haven't found an mesothelial cells sa sample ninyo, so it is significant. So, we can associate it sa, tuberculosis. Okay. And then, hindi last. chemical testing for pleural fluid. Okay, so we can test for glucose. We can see increased amounts of glucose sa cases ng rheumatoid inflammation, or kaya naman decreased if there is purulent infection. Okay? Okay. So we can say na decrease if it is less than 60 mg per dl. Okay? Ano yung purulent infection na tinutukoy if cause is TB? Okay? Lactate elevated in bacterial infections, triglyceride elevated in chylous effusions, pH decreased in pneumonia, decreased in cases ng pneumonia na not responding to antibiotics. Okay? Okay? Also markedly decreased with esophageal rupture. Okay? So we can see markedly decreased values of less than 6 na pH. Okay? Kapag merong esophageal rupture. Okay? So that is due to influx of gastric fluid. Okay? ADA elevated in tuberculosis and malignancy with a value of greater than 40 units per liter. The amylase is elevated in pancreatitis and esophageal rupture and malignancy. Okay. So for microbiology, the most common causative agent for infections ay si Staph aureus, Enterobacteriaceae species, anaerobes, and Mycobacterium tuberculosis. So, depende po sa bacteria na gusto natin isolate. So, we can do gram staining culture, acid fast if you're suspected ng TB, and mycobacterial culture. We can also do serological tests. Tests for anti-nuclear antibody and rheumatoid factor are the most frequently performed. Also, detection ng malignancies. Okay. So, carcinoembryonic antigen for metastatic uterine cancer, for breast cancer, and for lung cancer. Yan. Okay, so, yun yung mga tests na pwede natin gawin sa pleural fluid. Next is pericardial fluid. Okay? So, normal volume ng pericardial ay small amounts lang ranging from 10 to 50 ml. Okay? So, pericardial effusion happens when there is a infection, malignancy. Okay, so, infection, we term it as pericarditis, malignancy, or trauma-producing exudates. Okay? So, kaya nagkakaroon ng effusion within the pericardial region. Okay? So, effusion is suspected when cardiac compressions is noted by the physicians. Okay? Or if there are cases ng tamponade. Okay. So, what is the normal appearance ng pericardial? So, normally, it is clear or pale yellow. Okay? Pag ganun po, that is only a transudate. Okay? Blood streak, we can see it kapag may infection or malignancy. Okay, so infection or malignancy causes, so that is an exudate na. Grossly bloody, pag may cardiac puncture. Anticoagulant medications causing bleeding. Milky, if chylous or pseudochylous, so increase in triglycerides and cholesterol. Okay? Yan. So, yun yung associate natin kay pericardial fluid. Okay? Additional tests. If there's an increased neutrophil, okay, we can associate it with bacterial endocarditis. Increased neutrophil of greater than 1,000 WBCs per UL. Okay, so bacterial endocarditis with high percentage niyang neutrophil. Okay. So, malignant cells also are frequently encountered as the result of metastatic lung or breast carcinoma. Okay. Also, kay carcinoembryonic antigen due to cancer. Okay, so, we can do gram staining and culture when endocarditis is suspected. Okay. So, acid fast if suspected si TB, tuberculosis, as well as si adenosine if suspected na tubercular effusion. Moving on kay peritoneal fluid. Okay. So, for peritoneal fluid, ang term natin dun is ascites instead of serous. Okay? So, if there's effusion between peritoneal membranes, ang term natin dun is ascite. This is much more used rather than peritoneal fluid. Okay? So, ang term natin is ascitic fluid. Okay? So, we can see increase in ascitic fluid if there is hepatic disorders such as cirrhosis. Okay? Also, if there is peritonitis and malignancy, so this is the most frequent cause of exudative fluids. Okay, so for us to get peritoneal fluid, often done is a peritoneal lavage. So this is a sensitive test to detect intra-abdominal bleeding in blunt trauma cases. If there is a 100,000, greater than 100,000 ml per RB, greater than 100,000 ml RBCs, okay, so it is indicative of blunt trauma injuries. Okay. So alongside ng RBC counting, so we can also use radiographic procedures to aid in determining the need for surgery. Okay. So if greater ang bleeding, okay, so hindi kayang i-resolve on its own, okay, so andyan napasok ang surgery. Okay, so how do we differentiate peritoneal transudate from peritoneal exudate? Okay. So, ang pinaka ginagamit po natin dito is si SAAG, that is serum acid albumin gradient or difference. Okay? So, kukunin mo yung serum albumin levels and then acetic albumin levels and then subtract them from each other. Okay, so the difference between the two, greater than 1, that is a transudate of hepatic origin. Okay, less than 1.1, okay, that means it is an exudate. Okay, so greater than 1.1 is transudate. Less than 1.1 is an exudate. Okay, example, serum albumin mo is 3.2, your fluid albumin or acetic albumin is 2.3. Sorry, 3.2 minus 2.3 equals 0.9, so that is less than 1.1, so it is an exudate effusion. Okay, so what is the appearance of our peritoneal fluid? Okay, so it is clear pale yellow, that is the normal. Turbid, we can associate sa microbial infection, so increase CWBC, kaya siya naging turbid. Okay, so green, we can see if there is bile, gallbladder, pancreatic disorder, so nagli-leak si bile within the cavity, so kaya siya green. Blood streak kapag may trauma, infection, or malignancy. Milky if there is lymphatic trauma and blockage. Okay, so milky, increase cholesterol and triglyceride ulit. So since there is a blockage with the lymphatic vessels. Okay, so peritoneal lavage. Ayan. So greater than 100,000 RBCs per UL indicates blunt trauma injuries. Okay. So laboratory test, normally ang WBC within the peritoneal fluid is less than 350 cells per UL. Okay, so if there is an increase in bacterial, there is an increase in WBC, okay, we can associate it in bacterial peritonitis and cirrhosis. Okay, so if your neutrophil is greater than 250 per UL or 50% of the total,